Welcome everyone to our 12th annual Beer Summit. This is part of Global Citizens' continuing conversation series on race, class, and power. Obviously, for the first time, we're having a virtual conversation because of the health crisis, which is also a major part of the theme of this critical discussion on the double pandemic, COVID-19 and racism. Global Citizen is a 25-year-old nonprofit organization that works for racial and social justice through civic engagement, citizen action, and educational programs. I want to just let everyone know that this is being recorded. Conversation is being recorded, and we are also live streaming at globalcitizen365.org. So for those who are not in the actual event itself, able to have part in the conversation, that is also available, and we encourage you to share that website for people to live stream. Again, it's globalcitizen365.org. Also on our website, to support our work, we have a donate button, which you're welcome to learn more about what we do and support us if you would like. Tonight, I want to first thank our two special guest conversationalists at this very precious time in our world. Dr. Ayla Stanford is the leader of the Black Doctors COVID-19 Consortium, and attorney Michael Coard, as many of you know, is a civil rights lawyer and a fierce warrior for social justice. You'll be hearing more in a moment about them from our moderator, Reverend David Brown. I should tell you earlier today, Dr. Stanford and Michael Coard had a compelling conversation with Michael Smerconish on his live Sirius XM radio show. And those listeners around the country were invited by Michael Smerconish to join us for our live stream. So I hope that means that we have people from all around the country. For those of you who don't know why we call this a beer summit, it goes back to 2009 when Black Harvard professor Henry Louis Gates was arrested on his own porch at his home. He had just returned from a trip to China, and he was having trouble getting in to his house, and he was pressing hard on the door, and a white woman who was walking by across the street thought he was breaking into the house, so she called the police. This turned into a massive national story, an international story. As a result of the reaction and the outrage, President Obama invited both Professor Gates and the Cambridge, Mass. Police Sergeant James Crawley to the White House for a conversation about the incident over beer in the Rose Garden. And thus the name Beer Summit was created. We at Global Citizen, as we joined other people around the country watching this all unfold, decided that we weren't just going to be observers of a beer summit at the White House. We wanted to do our own. So we organized a conversation of a diverse group of about 50 people, concerned citizens in Philadelphia, to talk about the incident, to talk about race in America. Many of you will remember in 1992, James Carville's famous declaration that it's the economy stupid. Nearly 3 decades later, I think we could probably say it's the pandemic, the double pandemic, in fact, stupid, perhaps. The convergence of a health crisis that knows no boundaries, with inequities born out of systemic racism. We know that racism is alive and well in so many different layers, but I think that we've begun to see somewhat of a shift, particularly of white people beginning to see their culpability in perpetuating systemic racism, and perhaps the beginning of a process that could lead to change and perhaps an anti-racist future. The question, as I'm reminded from Dr. King's 1967 book, is where do we go from here, chaos or community? So we have a lot to talk about tonight. and frankly, a lot to do in the future. But with that, I want to introduce our moderator for tonight's conversation. He's a college professor, a pastor, a nonprofit leader, and longtime activist, but most of all, he's a great friend, David Brown. David?
Thank you so much, Todd, and welcome everyone. It's so good to see everybody. Everybody just give me a wave so I make sure you're there. As Todd said, I'm also a college professor, so I like to make sure my classes are engaged and not doing anything else while we're in our class. But I'm so glad to be part of this. And what's a special honor for me is that I was privileged to actually host the very first beer summit that we had, which was somewhat spontaneous. And if you're drinking, Mr. Guide, I'm actually drinking water. I'm not drinking beer tonight, but we want to raise a glass because what we have found is that sometimes the commonality or the common act of extending an invitation to somebody else just to have a conversation is critically important. And we've had the privilege of having these various conversations over the course of the last 12 years, which is both enriching and enlightening, but also a little bit depressing in that we are still talking about it. But the one thing that I love about these particular sessions is that we are actively doing things about problems that we see. And that leads me right into our two conversations today. Certainly, I'm sure that many of you may know of Dr. Ayla Stanford and Michael Coard because they have put activism into the word activist. They don't only talk it, they do it. And I can give you some brief background. Michael Coard, who I've had the pleasure of knowing for some time, he's both an activist and an attorney. He's also someone who has moved forward in some very critical areas of our community in terms of representation, particularly with African-American men in particular. He's been a role model. He's also a colleague of mine in that he also teaches at Temple, I'm proud to say. And also, he and I share a common connection to 900 AM WURD, where he hosts a program, and I happen to serve as the general manager for WURD for some time. Dr. Stanford, I've got to know really by reputation, quite honestly. When I first heard about the outbreak and saw what was happening, I think Dr. Stanford kind of stood up and said, well, we need to do something about this. As a matter of fact, we were on a planning call a couple of weeks ago, and actually her brother, who conveyed some of these thoughts about Dr. Stanford, saying that, you know, sometimes in an African-American community, we're waiting for the cavalry to come, and we need to be our own cavalry. And certainly the Black Doctors Consortium has gotten out there. I have been a beneficiary in that I have my congregation in West Philadelphia has received testing through Black Doctors Consortium, so I really appreciate that. And instead of giving you all more information on both Brother Michael and Dr. Stanford, I'm going to yield to them because I really want us to get out of the way so the conversation can happen. So let me give you folks a few ground rules just so we'll know kind of going, if this is your first time going on Zoom, a couple of things to recognize is that if you're not speaking, and I'm going to ask everybody to remain muted while both Michael and Ayla are having their comments made. After a period of time, and we're going to give them both about 10 minutes apiece, we're going to be going into assigned meeting room. And again, I'll give you some more information about that, where there will be a facilitator in those meeting rooms to be able to kind of talk through some of the things that both Michael and Ayla will be sharing as part of their remarks. We're also going to be giving you a question that we hope everyone will be able to kind of tackle and get into that will be informed by what both Michael and Ayla share with us. So with that being said, those are kind of our ground rules. If there are folks who, once we come out of those sessions, we will then be regathered in a broader group where we're going to have an ongoing conversation about what you will be talking about in your individual group. So we want to tease those conversations out because we really do want to focus on what Todd had mentioned before, where do we go from here? And that's a very important part of what we're going to look to do. So with that being said, I'm going to yield to Michael and Ayla. And I'm not sure we worked out, Michael or Ayla, who's going to go first.
Ayla, the good doctor.
Okay.
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 All right. So Dr. Stanford, I yield the floor to you. Go right ahead with your remarks.
Okay, wonderful. And I am a timekeeper. Okay, 6:10. So good evening, everybody. My name is Ayla Stanford, and I am a native Philadelphian, born and raised. I was born right at Einstein at Broad Knowley and grew up in North Philadelphia, Germantown, and Mount Airy. I went to Penn State, and then I went to Penn State undergrad. I matched at downstate in Brooklyn for general surgery, but I wanted to become a pediatric surgeon and no one had done that. So I found a job at University of Pittsburgh doing research. I did research there for 2 years, then finished my general surgery training. Then I went to Cincinnati Children's and all of that. I finished high school at 17 and 18 years later, I was board certified in pediatric surgery and adult surgery. And I came home to Philadelphia. So in 06, my first job was at Temple and also St. Chris. And then while I was at Temple, I was the director for the Center for Minority Health and Health Disparities, and then also a pediatric surgeon at CHOP in Cooper. And now I am in a space where I'm on staff at Abington Jefferson, but I'm in my own private practice as a pediatric surgeon. I figured that was important and what got me to here. So I'm basically in my remaining 9 minutes, that was who I am. I want to talk about why I formed it and why African Americans are more affected, what hasn't been done, what needs to be done, and where we're going. So how March 2020, people started calling me, why do we have COVID? Is it really a thing? Is it 5G? And everyone was calling me. So I had to start making videos. I started making videos on all the Instagram and so forth and Facebook, doing Instagram Live with people much younger and much older than me, trying to dispel a lot of myths. And then on April 3rd, the Tribune put out an article that said that African Americans were dying at a rate greater than every other ethnic group. And that made me pause. So I reached out to the city, to my senators, to Congress folks to say, what are we doing? I'm a surgeon, we're not operating. The hospitals are closed pretty much except for COVID. And no one had anything going on. I'm like, but we know the zip codes. We know where everybody's being most affected. I'm driving by, I don't see any testing units. What's going on? So ultimately, I found out nothing was going on. And I kept getting calls from folks saying, well, I went to Einstein, but my script was from Jeff, so they turned me away. I went to Chestnut Hill, I'm 50, I needed to be 65, so they turned me away. I went to Abington, I took 2 buses to get there, but I wasn't in a car, so they turned me away. And I was like, this is ridiculous. So once I heard all those stories of what the hospital was doing, I essentially created a program that was completely opposite of everything they were doing and called it the Black Doctors COVID-19 Consortium, purposefully because there is a huge mistrust of African Americans with the medical establishment. And I'm sure we'll get into that later. But I wanted the Black community to know that this was a group of Black doctors and nurses and students who have said, the hospitals are not giving you what you need. The FQHCs and the city health departments are not where you need them to be, but we are here and we are going to give you what you need, which right now is a test, which was coveted at the time. I tried to get my hands on the test. They said only if you're doing more. It was a long back and forth with the company. And I said, if you give me the tests, I can do them. First, they sent 20. The next day we did 150. And the next day we did 500. And they kept delivering. They said, what if people don't have insurance? I said, how much is the test? They said, $100. I said, you're gonna bill me. For every person without insurance, you're gonna bill me and I'm gonna figure it out later because there's no reason why a person should die for a $100 test. And so on April 16th, initially we went door to door. If people logged into the website, said they needed a test, we showed up at their front door in our PPE, and I'm a surgeon. So I had N95s and gowns and gloves, enough for my friends. And we did that. Then with my pastor, who has a great relationship with other pastors, we went to every church. Why? Because in the Black community, the church is a place of refuge, of safety. Even if you're not Christian or you're not some other religion, you know that it's a safe haven. So we also went to mosques and so forth, and to labor unions, but we went to an edifice in the Black community where people would come out. And that's essentially why. Why did we do it? Because it wasn't happening. And interestingly, when the CARES Act was passed in the end of April, all of a sudden there were all these testing sites that were popping up all over the place. But prior to that, prior to the hospitals knowing how they were going to get paid, they did not exist. And even today, they still say testing must have a referral, must have state-issued ID. What does a state-issued ID have to do with getting a test for coronavirus? Okay, why are African Americans more affected? So many people have said it's because African Americans have poorly controlled diabetes, poor hypertension. They use the ER for their primary care doc. They don't go to the doctor regularly. They're non-compliant. In medicine, as a medical student, the first thing you learn is never blame the patient. That's been all about blaming the patient. And studies that have come out from MIT and the Brookings Institute both show that when you control for all the comorbid conditions, the only thing that stands out as an increased chance of disease and death is being Black. Not how much money you make, not whether you have insurance or not, is being Black. So I think, may he rest in peace, Mr. Kane that died today. I don't think he was poor, but he was Black, right? I say that to say many of my friends who were calling me having challenges getting tested, they were not without insurance, living in dilapidated housing. So please, if nothing else, and every chance I get, stop saying it's because we're obese, our nutrition is poor, and look at the reasons. Yes, the virus does not discriminate, but the people who provide the resources for testing and who open the door for you to get treated do. And there, whether it's commission or omission, it is happening everywhere and definitely in our cities. What hasn't been done? So we had the CARES Act, which gave $4 billion to the state of Pennsylvania. 579 million of those dollars went specifically, 100 million to Jefferson, about 70 million to Penn, 50 million to Temple, and so on and so forth. And we were so busy in the midst of the pandemic in May that we all missed that. Money supposed to be spent by December 31st, 2020 to mitigate the spread in vulnerable populations. Now, yes, healthcare workers are exposed. Yes, the elderly and nursing homes and assisted care facilities are at risk. The number of folks in nursing home and personal care homes in our region is 125,000. The percentage African American of the 1.6 million residents in Philadelphia is 44%, or 705,000. But yet, every time someone speaks, and Dr. Farley and I are working this out, he will say the most vulnerable group is our nursing home residents, which I don't disagree with, but you're talking about 100,000 people versus 700,000 people. So why is it that the push, nursing home, what about the other 700,000 residents that are African American? So on Tuesday, with my testimony to City Council, what I proposed, and I hope that we can execute, that in this city, we have 5 medical schools. Every school needs to pick a day, and from 9 a.m. to midnight, they need to offer barrier-free testing. Why? Because the government, without guidance, gave them $100 million in down to do just that. But what happened with the money? None of us were even paying attention. Nothing happened. There were no outreaches in Fishtown and in West Philly. Even today, if you don't have a script, you can't get in. There's no night hours. There's no weekend hours. Right now, I had to leave my group over at Penn Memorial on 54th Street, and they're testing right now because people got off work and they need a place to go at night to get tested. The other thing is, in addition, the CARES Act paid for every test, So there's no reason why the hospitals shouldn't be opening their doors wide, because even if someone doesn't have insurance, you can get reimbursed. So it baffles me as to why, and all the hospitals have in-house testing now. So when I test people, because 80,000 people a day are being diagnosed, it takes up to 2 weeks now, when it used to take 2 days to get our results back. Did you know if you went to the hospital, you'll get your results back in 4 hours? If you have a primary care doctor and you have good insurance, your doctor advocates for you, you will get your test back within a day. Meanwhile, everyone else, it's having to take up to 2 weeks to get it back. Why can't that technology be afforded across our city? Particularly when the federal government gave you money to help decrease the spread in the vulnerable populations. This is all systemic, it's all institutionalized, and because folks are so conditioned, and because there are no folks at the table making decisions, it's just like, okay, we got the money to help us decrease the amount of money we lost with all this COVID because we can't do operations. So we're going to use it to make sure we hit our bottom line. But what are you doing for the vulnerable groups? That's where we're going. The cases are going up in Philadelphia again. I don't want to see us back where we were in April, where 1 in 4 person in certain zip codes had coronavirus. We're at 5%. We don't want to get back up to 25% like it is in Texas and in California. We can't afford to make the same mistakes we made in April now. We know what you need to do. Everyone knows, even a child, social distance, 6 feet, wear a mask, wash your hands, don't have large gatherings, right? And get a test so you can be treated. Contact tracing can ensue. You can let your friends know so they can quarantine, and the city can have a real contact tracing effort, which includes a place for people to go once you identify that they have coronavirus. It's not just enough to say, yeah, you had a true exposure, which, by the way, is being within 6 feet for 15 minutes or longer. Where am I supposed to go? So it's not enough to call and identify. You have to have a plan in place for an individual to go. That is true contact tracing. And
Stanford, I gotta jump in because I gotta make sure we stay on time. So
that was my 10. That was my 10.
and we knew this was going to happen because these are so important and complex issues. And certainly we appreciate, because we're going to be talking more about some of this. So let me, at this point, introduce Michael Coard, who I was taking copious notes when Dr. Stanford was talking and looking at how people are kind of plugging in, because as we recognize, this pandemic is one part of the larger side of the protest, and some of the inequities that Dr. Stanford has mentioned certainly have come to the surface as it's been manifested itself in some of the protest actions that we're seeing. So Brother Michael, if you would go right ahead and offer your remarks.
You know, the $500,000 you all paid Dr. Stanford to participate in this was well worth it. I mean, just thoroughly impressive. Having said that, you know, obviously I'm joking because I always say that I'm not a lawyer who happens to be a Black man. I'm a Black man who just happens to be a lawyer. And I don't know the doctor, just met her today, but I can say the very same thing about her. She's not a doctor who happens to be a Black woman. She's a Black woman who just happens to be a physician, and a great one at that. So I'm so glad that Todd had the foresight to bring us together so we can share information. And the topic tonight is a great topic, two pandemics, COVID and racism. And I'm going to focus, directly on racism. The good doctor dealt with racism in connection with COVID. And I want to start out by saying that the idea that Todd came up with, the Beer Summit, is an excellent idea because it brings not only people together, but people probably with differing views. And it's important that you sit down with those who you might disagree with in order to try to reach some type of agreement. I say all that to say that when we look at what happened back in July of 2009, I think that President Barack Obama is the greatest president in American history. But the bar is kind of low considering you got slaveholders and that kind of thing. But in terms of intellect and foresight and all that, I got to give him credit. But I'd be lying and I'd be doing myself a disservice if I say that I was feeling him on this beer summit. I love what Todd is doing in connection with bringing us all together. And Todd could have come up with that on his own. But in terms of what the president did, I'm not feeling it, but I understand it. When I say I understand it, he's the president of the United States of America. In fact, he's still the president as far as I'm concerned, but that's a whole nother issue. So as the president of the United States, and see, as I said, I don't know Dr. Stanford. Now she got that shirt on. I'm talking about Obama, and we didn't even script it. But having said that, I'm not feeling his capitulation in connection with what now is known as the beer summit. I call it the fear summit, because he came up with this idea after allowing himself to be browbeaten and chastised, after he made 3 objectively factual statements. He said that 1, anybody who would have been victimized like Skip Gates was would be angry. No argument there. Number 2, he said that what the cop did, Sergeant Crowley, was stupid. Well, if stupid is synonymous with ignorant, then President Barack Obama was right, because it was stupid. You can't arrest somebody for disorderly conduct on their own property, on their porch, in their house. That's where the good doctor was, Dr. Skip Gates. So think about that. If the cop is a law enforcement officer, he has to know that disorderly conduct by definition is a crime that affects the public. It has to be in the public, blocking traffic, starting a fight on the street. So to the extent that President Barack Obama said that it was stupid, he was absolutely right. It was stupid if stupid is ignorant. Then the third thing President Barack Obama said is that Black folks and people of color are disproportionately confronted by police. Well, no argument there. But then after he said it, he got such a backlash, he felt that he had to apologize by putting together this beer summit as a result of what some experts said. He put together some of the top experts around the country, and they came up with a conclusion that both Dr. Skip Gates and the officer was wrong. How the hell did you decide that? Skip Gates didn't do anything wrong. Let's put the shoe on the other foot. Could you imagine in America a Black police officer confronting a scholarly, well-known, international renowned academic at his house, and then that Black cop arrests that white scholar? That's totally unheard of. So for these leading law enforcement officials to issue a report to President Obama that both sides were wrong, that's absolutely outrageous. That's why, with all due respect to the greatest president in the history of the United States of America, he capitulated. But I'm a pragmatist. I'm a crazy, agitating revolutionary, but I'm a pragmatist. What I mean by that is President Barack Obama was not the president of the Black United States of America. He was the president of the United States. And I learned as a political science major at Cheyney University that politics is defined as the art of compromise. And that's what he had to do. But it's clear to me that it's not something, we should all understand it as a political ploy and say, okay, President Barack Obama, we understand you did it because you had to do it, but you certainly didn't think that Dr. Skip Gates was wrong. You certainly didn't think that Sergeant Crowley was right. So I don't call it so much a beer summit. I call what Todd is doing a beer summit. Great idea. What the president did was more of a political fear summit. Having said that, to the extent that we're talking about, and I believe we got 10 minutes, so I'm going to make sure I wrap this up. I think I got 5 minutes. Dave's going to give me the heads up. By the way, I got this trick that I do during closing arguments. I always tell the jury I'm going to be here 15 minutes. And by the time I get to 20 minutes, I tell them there's 10 more minutes left. But Dave's not going to let me do that. So I'm going to put all this together in 5 minutes. To the extent we're talking about 2 pandemics, COVID and racism, I defer to the good doctor because she laid it out perfectly in regard to COVID. So I'm going to stay in my lane. When we talk about racism, racism is America and America is racism. When people see horrible things going on, they say, that's not the America I know. Well, damn it, you don't know America, because America at its core is racist and brutal and thuggish and horrific. And you might say, well, Mike, that seems like hyperbole. Come on now. Okay, well, let's break it down. The birth of American slavery as we know it began on August 25, 1619. So clearly, that's a blemish for America at the very beginning, August 25, 1619. And then, and by the way, people often debate the issue of Black Lives Matter, and the rebuttal is always all lives matter. Well, first of all, the analogy I give is that there are 10 houses on the block, and one house is burning down. And when the firemen come, people on the block say, hey, all houses matter. No, all houses don't matter. Only the house on fire matters, especially if the 9 neighbors in that 10-house block are the arsonists. And that's America. So all lives didn't matter in America in 1619 with the birth of slavery. All lives didn't matter in 1776 with the Declaration of Independence, because you got 56 white male property owners, 75% of which, that equals 41. 41 of the 56 were slaveholders or slave investors, 1776. Fast forward to 1789, the Constitution of the United States was adopted. 3 blatantly racist clauses, 3/5 clause, runaway return clause, and the 20-year extension of the importation of slavery built into the fabric of the Constitution. That's America. Then we fast forward to 1857, the Dred Scott decision. And people don't know that in 1875, there was something called the Slaughterhouse Case, which strengthened the Dred Scott decision. Then we fast forward to 2013. 2013, just 7 years ago, when the United States Supreme Court gutted the 1965 Voting Rights Act. That's 2013. Fast forward to 2016. This is the final thing I say because I can feel Dave moving in. 2016, the Attorney General of the state of Kansas filed a brief and a legal argument and cited the Dred Scott decision to support his brief. Why? Because the Attorney General is a lawyer, and he knows that the Dred Scott decision of 1857 has never been judicially overturned. It was in fact strengthened by the Slaughterhouse cases in 1873. People might say, well, Mike, what about the 13th Amendment, 1865, and the 14th Amendment, 1868? Well, those are legislative actions. That's not judicial actions. So the fact that from 1619 up to 2016, and then you see a white cop strangle a Black man to death for all the world to see, when we talk about these 2 pandemics, COVID and racism, it's there. And Dave, I know I said that was it, if I had 30 seconds to say this. The question that I'm posing to those who are participating is this. You heard all the stuff I said, this ranting and raving about this crazy Black revolutionary. Yeah, that's all true. I plead guilty. But this is the question I pose to those who might disagree with what I said. Let's say tomorrow you were a defendant in a criminal case, and all things being equal, same income, same education, same home ownership, same neighborhood, same religion, all things being equal, you could go to trial tomorrow as a white defendant or a Black defendant. Which would you select? And if you're honest, the answer proves that there's a real pandemic of racism in America. Thank you, Dave, for not cutting me off.
Oh my goodness, there would be no way. Thank you, Michael. I mean, I'm always just amazed at kind of your encyclopedic knowledge on how you pull things together. And I really, really appreciate that. And we knew that this was going to be this kind of rich conversation. So what I'm going to do right now, I'm going to put a question that tries to summarize some of the things that Dr. Stanford shared and some of the things that Brother Michael just shared, that we're going to be going into our individual meeting rooms. So I'm going to put that up now. And in your individual meeting rooms, what's going to happen is that there will be a facilitator in those meeting rooms to help you wrestle with some of these questions. So for those who may be on the phone and may not be able to see what I just put in the chat, it says, as activists, allies, and advocates, how can we take this moment of social upheaval caused by both the pandemic and the protests to be the change we waited to see for so long. One of the things that Michael just mentioned was that scenario of if you were going to court tomorrow, which would you choose to be? And what Dr. Stanford had already shared with us earlier about how difficult it was just to get things that were already allocated to people of color. That is exactly the scenario that we're dealing with. So one thing that we try to do with the Beer Summit is really try to dig deep into all the things that our conversationalists have shared, but also to use our own intellect and information to come up with solutions. One of the great things about these particular settings is that probably rarely anywhere else in Philadelphia tonight, there will not be as diverse a gathering as what we're seeing right now. That's typically true when we get together for our Beer Summit, wherever we do it. And it's probably true on the Zoom call that we're having now. So we want to take advantage of all of those things, that diversity of thought, to be able to come up with some solutions. And when we come back out of our session, we're going to still have Michael and Ayla who will be available so we can acknowledge some of the things that you all will be sharing, while at the same time pushing us forward to some solutions. So I'm watching the clock. I'm going to now yield to our technologist folks, Calvin and Campbell, who will be putting us randomly into our discussion room. So you'll be assigned to that now. You'll be staying in there for a period of time. There will be a countdown clock. When you see your time is going to be ready to go back into the main hall for the conversation, and we'll pick things up from there.
Great, just stand by everybody real quick. Calvin's going to move us into our breakout rooms. You should see a pop-up. It'll say what breakout room you're going into, and you'll just click a join and you'll go straight into it.
Also, if you didn't receive any notification, that means you're still staying in the main breakout room, this room right now. Todd, you're muted. Also, Todd, you and Sarita should be the team leaders.
Yeah, Sarita's going to lead us. Unmute.
Hey guys, how are you? My name is Sarita Lewis, and I have had the pleasure of volunteering and doing some project work alongside of Todd and the rest of the amazing team at Global Citizen. And it is really an honor to be able to join you all tonight in this conversation. I think it is very, very important for us to have, and I'm really excited to hear what you all have to say. So I think that that David posted a really great question. And so do you guys need for me to review the question again so that everybody kind of knows what we're going to be talking about today?
That'll be great.
Awesome. Okay, so the question moved really fast on my screen. The question for us is, as activists, allies, and advocates, how can we take this moment of social upheaval caused by both the pandemic and the protest to be the change that we've waited for so long to be? So does anybody have any kind of thoughts that are kind of percolating immediately? And let's see here. Okay, okay, so I can't see any raised hands. So I am going to just see, Todd, do you want to kick off? I'd love to hear your thoughts on this. You have to unmute yourselves to talk though. No? Todd?
Yeah.
Do you have any thoughts that you want to share to kind of get us started with this?
Well, I think the difference between sort of where we've been in the past and where we are now is that there's been more of a sort of a diverse and collective effort of trying to put pressure, given the, whether it was George Floyd and Breonna Taylor and others. There was just, and I, honestly, I'm not quite sure why at this point we've gotten to this point where there is this groundswell. But I think there's it is the kind of ultimate opportunity, given the fact that people are being forced to take a look at one, the system and that perpetuates racism on so many levels, and on the academic level, and government, and in the private sector. And I just think that this is the sort of the time where we've realized that it's not acceptable just to say that we are, and I say this more about white folks than Black folks, that it's not acceptable just to say that we're not racist, that we really have to be anti-racist, and we have to come to a realization of what that means.
Mm-hmm.
And I think it means a lot of things. I mean, it's a legislative question. It's the way systems are operated in the private sector, in the public sector, and I think that there's finally movement in that regard. So I think the question is this a one-off kind of situation, or is it something that's going to be sustainable? I'd like to think it's the latter.
Okay, so so for anybody that doesn't know me, let me just tell you, I've got lots of opinions all the time. But one of the important question that I see here is, how can we having difficulty with double or replay on the audio? Oh, okay, Rashida. So one of the the big question is, how can we be the change? How can we be the ones that are kind of creating a difference right now? I feel like we're in a time where we've seen situations where we've had leaders come to the top and really be the ones that kind of push the agendas for us. And in this time, I don't think that there's any one leader stepping up to the plate, nor do I think that we require one. And I think that in the times that I've actually been going out into the community and talking to folks from different backgrounds, one thing's been ultimately very clear for me is that nobody is looking for anybody to be the voice for us. I think that for us to be successful in this time of opportunity and change, it means that we have to be collective in identifying what we want. So we need to develop an agenda. And our agenda is actually going to have to be one where a large majority of us have agreed upon the things that are required for us. And I also think, so when it comes to dealing with both COVID and with racism, we need to be able to identify some of the things that are most important for us. And so hearing from the amazing doctor earlier today, she was great at pointing out a lot of the things that we did not know. Like I didn't know. I don't know. Did you guys know about that? What was it? $500 million for $579 million to Pennsylvania. That's ludicrous. And to have the leadership in hospitals decide that we still don't deserve to have full services, and people are still without the resources that they need, is just crazy to me. But so for me, I think that us identifying what we can in terms of how we are going to require our treatment when it comes to medical treatment, and then also as a larger community. I mean, I love how diverse this group looks. As a larger community, understanding what racism really is, and it's about the power structure. And so being able for us to recognize that the power structure exists systemically, medically, it's all over the map. But if there's going to be real change in terms of the the power structure, somebody has to give up the power. There has to become balance. There has to become a way for white people to decide, to understand that as long as things only happen when they become upset, they haven't released the power. It has to become a point where we are all being able to have our voices heard. And so, yeah, we need to figure out ways to alleviate the top heaviness for the power, and then also determine how we are going to work effectively across communities to develop some parity. But that's how I feel. And I'd really love to hear how you guys feel.
Yes, Sarita, my name is Subbu. I work generally in the healthcare spectrum, and for me, I know like within the healthcare teams, etc., people are looking into the health, disparity, and for me, it was really eye-opening to me what the doctor, talked about, right? For I feel like some of the systemic racism she talked about, we really need to get grounded on what that is. That's what I feel, because if many people don't know, even if in fact within the Black community people don't know, then we really have a problem, right? Of understanding that it really exists. So even being in the healthcare, community in general, I think I think it needs, I'm speaking for the healthcare community, but at the same time, it actually probably each of us, whichever, professional, personal thing that we are associated with, we should take that, take this and get educated and really kind of voice within our area. That's how we can really kind of voice this. Okay. That's my opinion.
So Subbu, so I have a question for you, and then I'm actually going to move to Tammy. Thank you. I see hands now. That's awesome. I'm excited. So Subbu, being in the healthcare community, you have you have this amazing perspective, and I'd love to hear from you. What are things that you think the medical community could actually do to create balance? Because as you clearly heard from the doctor, there's huge imbalance when it comes to the way that Black people are treated medically.
Yeah, and I think, I think within the medical community, I think it's really intentionally looking into it. I don't think folks, generally the health disparity, is so far this health disparity is has been looked into from a social determinants perspective, right? That's broad, and I think that's where the doctor clearly mentioned is like, people kind of look at it from a like poor diabetes, and all that stuff, and then like people bucket them under, it's because of that. But I don't think intentionally people have really looked at the disparity of care. And that needs, we're talking about social determinants within the healthcare community in the last few years. And let's be honest, we don't have the best healthcare system in the world in the first place. We are like 75th rank in the entire world in healthcare. And we're just starting to look at the social determinants just now, but I think it's, given what's going on, it's really high time, like everybody within the healthcare community really intentionally focuses on disparity, and even on the patient side and patient side, really voicing that, right? We're all, potentially patients, but, members of health plans, raising that to our insurance companies, raising that to our, University of Penn, if you see a doctor at University of Penn, really kind of voicing that to them. right? Because I can tell you the health insurance companies are, starting to look into it a little bit, more. Provider communities are starting to look at it in more, but they need that feedback from the patients also.
Gotcha.
So I think that's where we need to start.
Thank you. So I have written down that you think that the healthcare industry should actually be more intentional with their way that they're looking into racism that's happening systemically within the healthcare organizations across the board, and also look at what the social determinants are, and also ensure that our patients are raising issues with not only the providers, but also with the insurance companies. Yeah?
Correct. Yeah.
Awesome. Tammy, hi. Unmute yourself.
Hi, how are you?
Doing great.
I guess I need to introduce myself. My name is Tammy Crummy. I work at Jesus School. I'm the Dean of Students. And I also work with Crystal Ray Philadelphia. I'm the PTO president. I have a son who graduated and a son who's a senior this year. I also did social work for 13 years. That's a little bit about me. So my thought process is similar to what Sabu said across the board. Did I pronounce your name right? I'm big on that. I hope I did.
Yes, almost. Subu. Yeah, thank you. Yeah.
I apologize, Subu. A lot of what he said, I personally and professionally feel like a lot of education needs to take place for everyone, because like a lot of our children, they saw a lot and they understand that people are angry, and they relate it with a lot of everything is like white supremacy, not the systems that are in place to hold us back. They more so relate a lot of things with white supremacy across the board. Like if you call someone racist or you say that they're racist, it's automatically that it's more on that lines of things. And like we're trying to educate the children and say, well, you can be racist, but not be a white supremacist, if that makes sense. So we need to break down all of the different things that they're seeing and they're hearing and help them understand. But then on the flip side, we need to educate all of the educators who are supposed to be educating the students so that we make sure that accurate education, I'm going to use that word over and over again, is what's taking place. Because I have some friends, some of my younger colleagues and friends who are white, who are like, they feel like, and this is what they've said to me, my ancestors lied to me. So they feel violated in a sense too. And those are some of our people who are walking with us, saying like, this is wrong. And they're trying to see what they can do to help. But at the same time, they too need to be educated, and we need to be able to have open doors of communication, so that we all can understand what it is, the goal that we're trying to get to. Like you said, we're trying to get somewhere, but if we don't understand what it is right now or what it has been, how can we plan a goal to get somewhere or release or get out of where we are, if that makes sense?
Makes a lot of sense to me. I know that we are all kind of excited to hear everyone's thoughts. So if you'd like to say something, either raise your hand or unmute. Okay, Shelly, are you unmuting? Did you want to say something?
And it's funny, I was looking for where you raise your hand, but since you said or unmute, I guess I'm in.
Hey, Shelly.
Hi. And I see another Shelly here too, spelled the same way. I don't know if that's me double, but anyway.
Might be you double.
Okay. But Calvin, I'm not hearing the echoes, so I'm good. But anyway, moving on. So many things were said, and thank you, Tammy, Subu, everyone, Todd. But I have so much to say, but it's all not going to fit into this platform. But anyway, so let me just reach out with some of the things that we were talking about releasing the power. And so where do we begin? I mean, was it the chicken or the egg? That's what I feel like right now with this conversation. So how do the oppressed get the oppressor? And I'm just using these terms for lack of better words for everyone involved. How do the oppressed get the oppressor to release the power? Why would they? If they're, and we've all heard the term white privilege, if you have that privilege, who wants to give that up? And now, after having said that, on the flip side, power, like I've always been told growing up, he who has the gold makes the rules. Fine. The gold is not necessarily just money. We have power. We don't necessarily utilize it. Like the congressman who just died, and his funeral was today. Good trouble, necessary trouble. He spent his entire life, Martin Luther King, even Malcolm X, who was a little more controversial, but still stood up and used their voice, used their vote, used their power to make change. But I see today, I think, and the way I see it, is that sometimes we as African Americans, I'll say, are resting on our laurels. And we talk about these great men over and over, but we have generations that have come since then filled with potential great men and great women who have power. Okay, and with regard, and I work for Subu, I also work, I'm not going to say which health system I work for, but I work in the medical field as well. And even that, I mean, it's when you have generations and generations and generations of folks who don't understand the healthcare system, who don't have great access to the healthcare system, who don't have a legacy of knowing what to do with regard to getting what you deserve for your health, whether you have money or not, then this is what, what cultivates year after year, generation after generation. But those who know better do better. How do we get everyone to know better? I mean, I guess I have more questions than answers, but this is like fueling the fire within me. And as you can tell, probably I am a serious advocate. I sit on the board of an organization that empowers youth. I march. I do all these things, but I want to bring all of my brothers and sisters, black, white, yellow, green, whatever, along with me. And I'm elated at the fact that others are seeing the purpose and the promise. But how do we get those who have and I'm using quotation marks, power to share the wealth? So I'm putting that out there, and I'm going to stop.
Okay, so Shelly, I first of all love everything that you said, and right there with you. I think that you made a lot of really valid points. How do we compel those with privilege to actually release some of it and allow for the balance, and then also like that conversation about Black people resting on their laurels. I have one small thing to say about it, and then I'm actually going to toss this over to Calvin. Does that sound okay with everybody? Okay, cool. So the one thing that I have to say is, as it relates to engaging with Black folks who, as part of the systemic racism, you have to acknowledge that along with it comes people who have forced a community that definitely was trying to be able to create their own structures and develop their own, develop autonomy and agency within the community. We've had communities completely burnt down. We've had redlining, which still exists. We have people who are like going into prison now. Almost every single Black person that goes into prison comes out with a felony charge. It's intentional, to make it so that you can't get the type of jobs that you want and all this other stuff. So there's that. The other part to it is because you have so many moments where the power pushes back at you. You have people that just don't understand the rules. If you don't understand the rules of the game, you're less in a position to actually be able to play properly. And the people who do learn the rules to the game through politics or whatever are typically not going to actually show their hand to everybody else, because they kind of want to stay in the system of power that they finally got. So their little bit of power sometimes overturns with their ability to do for the larger community, it diminishes it because they hold on to it and they don't release it. And so those are just things that I thought of as you were talking, but I love hearing you. Okay, Calvin.
Hey. Hello, hi. So I am a criminal justice master at John Jay University right now. Mm-hmm. And from how we viewed the whole situation, like we've known from a very, very long time that the criminal justice system needs a complete overhaul mm-hmm. to get rid of the system. Because right now, what's going on is that like police stations or whatnot, they're hiring like 18-year-olds, and they're specifically hiring people who have less education. Like mm-hmm. Like they actually actively do not hire people who have higher education, like a master's degree and whatnot, mm-hmm. because they want those people to be indoctrinated into the system. And that's actually, I kind of know a lot about this because I was trying to apply for some police stations and whatnot. So mm-hmm. you're basically giving 18-year-olds, like they only train them for like 6 weeks, which is about a month and a half.
Yeah.
And they're giving 18-year-olds guns to control over the whole entire society. Mm-hmm. So I believe the main thing is to have a great education system. Mm-hmm. And that's not even going into how the whole prison system works, and that's a complete disaster in there because we focus more on punishment rather than rehabilitation, mm-hmm. Mm-hmm. which creates what we call prisonization, where people who enter prison who tend to not be, usually through a minor crime, usually like, drug possession or whatnot, and they end up becoming prisonized, and they become hardened criminals after when they leave the prison themselves, and then they kind of repeat the cycle. That's why recidivism is so high in the United States compared to elsewhere. But yeah, like right now we know it's a huge problem, but right now we can't really fix that because those 18-year-olds who were trained to become kind of indoctrinated into this like systemic racism become the officers. They get promoted to the high-ranking officers, and those high-ranking officers are the ones who influence lawmakers and whatnot. And so this whole system is just kind of backed up from the very beginning. And I don't exactly know how to fix it unless we kick out, essentially, we completely replace the whole system, like get rid of like the officers and whatnot, but they're not going to agree to that. And so and I don't think realistically that is possible for us to fire them and whatnot.
Got you. Okay, so what I actually took from you, and guys, I'm kind of reading back because I feel like what we're doing right now is shaping out a really great plan of how we get to our group of solutions. So we go back into to the main group, or rather they come to us because we're the best. What we'll do is actually be able to say, well, these are the kinds of concerns that we had, and these are the solutions that we came up with as a result of it. Does that sound about right to you guys? Does that sound fair? Okay, cool. So you, Calvin, you actually talked about the police stations and the police intentionally hiring less educated people because it allows them to be more easily indoctrinated into like the wall, if you will, the blue wall. And then we also talked about making sure, and I think that this has been something that everybody has been talking about, education. Education is key. And I think it's going to come down to us throughout everything that we talk about is making sure that we are developing some steps towards education that can be forward moving and that can be sustainable and that can actually create change, like real change, as opposed to just like top heavy foolishness that doesn't get anything done. What I also heard you talk about was prisonization.
Prisonization, yes.
Prisonization, thank you. Prisonization, where you turn people who are actually coming in with lesser crimes into hardened criminals, and thus also, we're ending soon, recidivism being very high. I think that one of the things that we might want to consider is legislation that will actually stop Pennsylvania from hiring contracting with private prisons. that's a step in the right direction, because there's no incentive for for our police officers to not put people in prison, because they've got to make sure that they hold a minimum, like, and usually it's like 75 or 80% capacity at all times. So, okay, and Shelley, it's not simply officers who are not POC. Oh, absolutely. I think that the blue wall it circumvents everything. I think that it actually is a much bigger process. So we actually are going to be ending soon, guys, and I want to be able to at least think of at least 2 or 3 things that we can do and we can do, or things that we think that collectively would be able to do that would actually start to turn the tide for us. So does anybody, and I guess, like, open up your mics, guys. Let's try. Does anybody have an opinion on a thing that we could do as an individual or as a group to just, everybody's coming back, y'all.
Yeah, they have about 30 seconds to return to the main room.
They're back here already.
Hey, Sarita, how you doing?
Hey, how you doing? So good to see everybody.
Yes.
Well, I was cooking, burnt my chicken up.
Oh no! Oh no! No, I bet it's still good though, Miss Karen.
And Miss Karen, I already apologized, so I'm sorry. Well, if I may, I know people are still going to be starting to come back in. So I'm going to try to, as best I can, as people are coming back in, to kind of get us refocused on the conversations, because this was and we knew this was going to happen. In our group, we had folks who were sharing some great insight, great information, and information with each other in terms of staying connected. And so what we want to be able to do as people are coming back in, and we should have a full house soon. I want to, again, encourage folks to use the chat function if you have a question, but I'm going to ask our facilitators to share out some of the things. And if they could share one thing that came out of their group that way, and if it's something that is different from one of the other groups, I'm going to ask that we can be a little bit distinctive about that. That will help us to share information while at the same time not duplicate each other's answers. So on my Hollywood Squares grid here, I have Sarita, you're right next to me. So if you would like to go first, and then I'm going to ask the other facilitators to follow you, and then I'll conclude, and then we'll still have time to connect with Dr. Stanford and Brother Michael.
That's okay, cool. So hey guys, so we had a really robust conversation. I think that there were a couple of things that came up because we had some folks who had some very specialized points of contact. So we had some folks from healthcare and education. But one thing that we all agreed upon was that education definitely needs to be the cornerstone of anything that we're going to be doing. And part of it is actually very much instilled in the idea of, actually, let me make sure I can say this right. The question comes to us of how do we compel people living in privilege to release their power? And so, there's going to be a lot of questions that go around that, but, for us, education was a large part in that to make sure that we could actually get some forward motion.
Excellent. Thank you for that, Sarita. And I'm also seeing a lot of good conversation in the chat, so I'm going to encourage folks to do that as well. Could our second facilitator then share one of the insights from their group?
Let me make sure I'm off mute. Okay, I am. We had a really robust. In fact, I wish I had known that we could have ignored you and kept going on for 2 or 3 more minutes. We were like really nerdy, and we said, "Oh, we got to stop. We got to stop." I wish I had known. I'll keep it going. Having said that, I just asked everybody at the outset. The question I posed in my opening statement: is there anybody here who would choose to be a Black defendant? Everybody agreed that's a no-brainer, and they said the implication from that is that there is blatant systemic racism in America. So there was no dispute about that. And then we said, okay, so what do we do to address the issues? And I said, look, when you have people, and I'm assuming they're all well-intentioned people, you bring 100 of them in a room, and you say, hey, what's the issue that we all can agree upon? What's the common denominator? You got 100 people in the room. I say, write your suggestion, put it in the bag. When I pull the bag out, there's 100 different topics. So now we go through a vote and we find out that of those 100 suggestions, there's only about 5 or 6 that everybody agrees with. So we agreed in our group to take those 95, 94, cast them to the side and focus on the 5 or 6 that we all agree upon. We can get to the other issues later. Maybe it's reparations, maybe it's this, maybe it's that. But if we can't get the majority to agree, we put that to the side. So the issues that we agreed were important was just what the first person just said, education. We said education, voting, and basic human rights. And by basic human rights, we're talking about healthcare, food, clothing, and shelter. So those are the things we say that every person of good faith would agree upon. So now we got our issues, education, housing, basic human rights, and voting. Now we bring this mass of people together and we move that forward. And in terms of moving it forward, our first speaker, I believe that was Karen, she stated that it's good that we're doing this quasi-revolutionary thing, but right now it seems scattershot. People just yelling and screaming. And I said, Karen, that's true, but that's the nature of revolution. It's like we're oppressed, we're locked into a jail. All we know is we want to get out of the jail. We don't know where we're going when we leave the cell. We just know that we want to get out of the cell. So we all agree with that. So again, in our group, we saw voting, education, housing, basic human rights as the key thing that people of good intention can focus on.
That's excellent. Thank you, Michael. And I'm taking some fast notes as we're going forward. Todd, I'm going to pass to you because I know that you were moderating one of the discussions, and then pass it back to me, and then I'm going to open it up to the rest of the group because I know that, as again, I'm seeing a lot of good things in the chat, but I want to take advantage of the gathering that we have here. So go ahead, Todd.
No, actually, Sarita was shepherding our group. So, I will probably have more to say at the end, but
okay.
I think we should share the opportunity here with the other groups.
Okay. So if I may then, I had a great group with ours as well. And so some of the things that you all had already shared, we did talk about too. But one thing that we thought was a powerful thing is how do we have these conversations with people who are not like-minded? You know, one thing that we have about our beer summit is that we have people who come together who, you know, by and large do agree, but how do we look at, and one of our participants, I think it was Campbell actually, who said that we have to be willing to take the table to them, not wait for the table, which I think is very consistent with Dr. Stanford's point about, you know, something's wrong, something needs to happen, something needs to be different. Well, let's get some solutions that will enable us to go forward. So we did talk about education. We did talk about inequity, but really one of our key things was how do we use communication, both social media and traditional media, to start broadening the conversation beyond our own circle of influence so that we can start to have this type of tension. And I think that, and I want to give props to Anita, because I think that Anita gave a really great analogy, and that was that if we're only talking to each other, then we're never going to be able to get outside that sphere of influence. So we need to try to find ways and recognize that this is going to be some tough sledding. It's going to be the rough weather is ahead of us. And I think to paraphrase what she said, how comfortable are we going to be in being uncomfortable with being uncomfortable? That's going to be key because it's not going to be easy. No one said it would, but that's going to be critical to that as we are able to move forward. So what I'd like to do is, if anyone, and I'm looking across the grid, has something that they really want to share, and I know my job is timekeeper, because what I'm going to want to be able to do is to allow both Michael and Dr. Stanford to offer closing remarks before Todd does. But I want to make sure that anybody that wanted to say something, to add something to the conversation, and again, please check your chat because there's some great stuff that's being shared on the chat. We want to be able to do that. So if anyone would like to, go ahead. Dan, I see your hand up. Go right ahead. Good, Dan, you're unmuted. Go ahead.
I just want to thank Todd and Michael and Ayla. gone to most of Todd's beer summits. This was really meaningful. We had a great group, and I'm not sure who in our group wants to speak for us. Megan, who was going to speak? No. Well, we focused on education.
I think Manisha was
go
going
ahead.
to speak. I think Manisha was going to speak.
Ahead. Yeah. You're up, Manisha.
You're going to have to unmute yourself, Manisha. Hold on a second. Go ahead on. You're still muted, Manisha. I see you're still muted there. Well, will somebody else from the group want to summarize?
Well, I'll just say we all worried that this, what feels like an inflection moment, might pass quickly given the attention span of the media and our culture. And that, speaking of and thinking of John Lewis today, we got to be focused on the long haul. We talked about a Truth and Reconciliation Commission, which is not a new idea, but one that is not a panacea, but it's a starting point. And tied to that is focusing on deeply on civic education, teaching slavery and genocide of Native Americans. We don't know our history. We can't begin to solve these problems. And understanding these conversations are tough. They're really not safe, like say safe conversations. They're hard. But a lot of focus on education, and just a lot of pain expressed. One of Caroline and others, almost everyone expressed just how painful it was to realize how deeply ingrained, and that it took the murder of Floyd to for people to see how systematic racism is, and that a lynching could occur in public like that in a city like Minneapolis. Am I missing? What else am I missing, guys? Alexandra?
I think you touched on it all. I think, among all those, besides all those things, we also kind of touched on education, like was mentioned before, and how important it is to just kind of keep educating and pushing that forward.
And I see that Megan Aceto, you've raised your hand. Go right ahead, Megan. Hope I'm pronouncing your name correctly.
Yeah, thank you. I didn't mention this in my group because the conversation never really kind of got there. But one of the things that I think I struggle with is talking about COVID-19 and racism both as pandemics, because I don't really see racism as a pandemic. I think it's a structural issue that is baked into the creation of this country. It didn't start in 2020. It didn't start in 2019, the way that COVID-19 did. And I think that thinking of it as a pandemic in some way releases us from our own complicity in how it takes up root in our own lives, even if we don't intend for it to do so. And, I think we all want COVID-19 to be over. My 6-year-old daughter keeps asking when it's going to be over and praying for it to be over. And my mom is saying, when is this going to be over? And I'm sitting here trying to pivot my work, which is all about immersion experiences for college students, to an online format, which is just so much fun. You can hear my sarcasm. We all want it to be over, right? But we've got to, there are things that need to happen along the way. Racism needs to end too, but the work to get there is, it's about so much more and so many different things than just finding a vaccine. You can't find a vaccine to vaccinate people against racism. We all have to commit personally in ourselves and in our communities, in our workplaces, in our families, to do the hard work of dismantling structural racism and speaking out when it matters, or, we're not going to make the progress that we hope to make. We all have to take the actions that it's going to take to get there, or we're just never going to get there.
Man, that was powerful. Thank you for that, Megan. And I should also, because I got a note from one of my other group members, we talked about the pandemic and we talked about protests, and in our conversation, we also talked about politics, being able to recognize that we are at a moment, and Megan, to your point, being able to recognize that this is work that has to be done over time. And we have to take advantage of the moment in which we find ourselves in terms of getting involved. And we shared some great information about voter education, voter engagement, voter participation. That is really kind of how we get involved into dismantling the systemic structure of racism. Because you're right, the pandemic has shown the disparities, but once we now show the disparities, what are we able to do to make sure that we build those bridges? So I'm looking at our time. We've got 10 minutes before we're supposed to conclude. Todd, if you wouldn't mind, I'd like to hand it back to Dr. Stanford for some closing comments, back to Michael Coard for some closing comments, and then back to you, Todd, for the close us out. So Dr. Stanford, if you wouldn't mind getting us started, and you've got 3 minutes.
David, this is Dan. Todd will want to shoot me, but is that a hard close? Are we cut off?
Yeah, because it is only that we want to be respectful to our speakers and that we go to 7:30.
Yeah. So, in watching John Lewis's funeral today, and I was just having a very exhausting day because everyone keeps talking about education, but that education falls on the doctor, the activist, the lawyer, the teacher. So it's like, I have to teach you your history. I have to teach you that it's structural racism, that what you did was actually a racist act, how to be anti-racist, and then how you should treat me as a medical person, how you would want your brother, sister, father to be treated. It's exhausting. And then in that moment, I looked as John Lewis is no longer with us at 80 years old, and he did that his entire life from the time he was 20, in his 20s, and probably before that. And so there is no tiredness for us. We just continue to press on. And I believe God made Black people for a reason. It is a resilience. It's a huge burden, but also grace and a huge responsibility that I'm feeling now more than ever in my life. And, as long as I have breath and health and resources and knowledge, I will keep doing what I'm doing, but it is exhausting. And that is just the truth of the matter. And I don't want that to sound deflatist or tiring. I'm just letting you know that people are out here doing it, but it's not easy. But then my mom said if it was meant to be easy, everybody would do it. So to whom much is given, much is expected and required. And, as much as I have my great home and I love it, I know what it means to live in North Philly and be on public assistance and live paycheck to paycheck and not have heat in the winter. And I know what that feels like. And I remember that every day I come into my house, and that keeps me going because I'm not special. There's tons of ALAs in Philadelphia. It's just, for whatever reason, I pushed, the opportunity was there and I grabbed it. And I just want to give more of those opportunities. And health is wealth, quite honestly. And that's where my focus and my purpose is. And so as long as I can do it, I will continue. And if no one showed us that more than John Lewis, then our eyes aren't open.
Wow. That was powerful. Thank you, Dr. Stanford. And there was a lot in the chat about self-care, and you need to take care of yourself too.
Yes.
Dr. I know you said health as well. So that's very, very critical. So thank you for that. Brother Michael, your comments. You may be muted, sir. Yep, you're muted. There you go.
I promised myself I wasn't going to do the old man thing and start talking while I was muted, but damn it, I did it. Anyway, I got 3 minutes. I got my timer here. Here's the thing. We look at the overwhelming nature of oppression, racial oppression here in America, and we think that it's truly overwhelming, but it's not. I often say, after hearing it from a much wiser person, just because you can't do everything doesn't mean you shouldn't do anything. So everybody needs to play a role in whatever lane they're in. You might not be able or willing to be a revolutionary, but you can support the revolution. And by revolution, I don't mean some violent attack on the government. I mean revolution in the dictionary definition of the word, a complete change. That instead of going this way toward fascism in America, you go the other way in terms of providing for people's basic needs. Now, I kind of want to get on my socialist soapbox, but I'm not, because that word scares people. But socialism simply means providing for people's basic needs. That's all it means. You need food and you can't afford it, you eat. You need clothing and can't afford it, we clothe you. So that's the kind of thing that I'm talking about. And when I say, even though you might not be able to or willing to be a revolutionary, but you can join the revolution, what I mean by that is when you see those protesters out there, support the protesters, support their cause, send money to the NAACP, send money to the NAACP Legal Defense Fund, send money to the ACLU, send money to the National Lawyers Guild. So you don't have to necessarily be on the front lines doing it, but you need to support those who are. And to the white folks, my white comrades out there, we really need you all, instead of, or I should say, in addition to coming to Black people and showing how well-intentioned you are, how pure of heart you are, because we trust you and we embrace you. But instead of simply coming to us, you got to go to your fellow white folks at your church, at your mosque, at your synagogue, at your job, at your golf course, at your restaurants. And if you can share with them the same great things you share with us, then the battle is basically won. So it's not so much white versus Black. It never has been. It's always been good versus evil. Good white folks, good Black folks. Evil white folks, evil Black folks. We just got to make sure that the good ones defeat the evil ones, and we can do it starting with things like tonight. So big shout out to you, Dave, and certainly to Todd.
Thank you so much.
3 minutes. Didn't screw up with the mute
again. Well, let me then hand it off to Todd for our closing comments. And Todd, again, thank you for the privilege of hosting and being able to moderate this powerful conversation. There's going to be a lot of things coming out of it. So go right ahead, my friend.
Thank you, David, for moderating. I certainly can't say it any better than Dr. Stanford has and Michael has, for bringing a level of understanding, for sharing knowledge and communicating what is, no doubt as Dr. King said, the fierce urgency of now, and showing us how important it is to have the impact, not just to talk about these things. And I can't help but think always of what the Spanish-American philosopher George Santayana said. He said that those who cannot remember the past are condemned to repeat it. And I think that all the focus on education that we've had tonight is so critical, because as someone whose name I will not mention said in 2016, I love the poorly educated. And we know why that person loves the poorly educated, because it keeps people in a place of oppression. So I think that, as Michael said, we've got to be willing to give in various ways. If it's money, if it's time, if it's learning more and sharing that. And also as a white person who does this, I think this is not a Black problem. This is a white problem, largely speaking. And so it's up to us to really look in the mirror and decide, how we will be the source of this solution. These conversations are certainly an important part of it. I invite everyone to join us in our continuing series of conversations on race, class, and power, and to join others in what is, almost a daily series of events and grassroots events in this city and around the country. So I have a sense of hope, but as also has been said today, there are a lot of forces that don't want change. So this is going to be a very challenging time. But again, I think that we've got the foundation, and I think hearing from everyone here tonight who is committed to do the work gives me a sense of hope. So thank you, David. Thank you, Ayla. Thank you, Michael. And thank you, everyone else for sharing in the discussion tonight. And with that, I think we will say goodbye and hope to see you again soon.
Great job, everyone. Good night.
Good night.
Night, everyone. Stay safe.
Bye.